We have a very interesting case today. He's a young man who suffered from COVID-19 infection, followed by he suffered from mucormycosis. Mucormycosis, otherwise commonly called as black fungus, is a very, very devastating disease, and it basically destroys the plane between the muscle and the fat plane and bones, everything it can destroy, especially in the maxillofacial region. And this patient also had mucormycosis and recovered from that. He went on his routine job, and after about a couple of weeks time, he had a massive epistaxis, that is bleeding from the nose. That is so massive that's about half a liter of blood came out of the nose. So they were very scared, and the patient was referred for further investigation with a CT scan and angiogram. And the angiogram demonstrated there is a large ICA cavernous aneurysm. This aneurysm has bled and temporarily just seized, and it has bled to the nose, and the patient has epistaxis. For further management of the patient, he was referred to us, and we did an angiogram. This is the angiogram of the left internal carotid artery, which is showing there is a large aneurysm in the. So we can see this aneurysm over here, and this is a cavernous IC aneurysm. This is the cervical portion of the IC, this is a petrous, and this is a cavernous portion. The aneurysm origins from over here, and quite large and significant aneurysm over here. So this is measuring about 13.9 millimeter into 7.6 millimeter in the two largest dimension. So just look at this anatomy. It's very irregular, and with the flow diverter, we'll just put the flow diverter across the aneurysm, and we will keep a catheter beforehand so that we can just coil and come out after deployment of the flow diverter. So whenever we want to do a flow diversion, basically we need to take a good 7F long sheath over here, and then we take a distal access catheter. It could be an Navion, it could be a DAC, and once we cross enough distance, then we take the microcatheter and wire and try to cross and place the microcatheter distal. Here we have taken a headway 27, which we have kept in the middle cerebral artery M1, M2. And once we have this beautiful access, so you can actually navigate the flow diverter easier. Otherwise you can have challenge. So it's better to have a 7F long sheath, then a distal access catheter, then your microcatheter in a little distal position compared to the aneurysm that we had. So this is perfectly positioned. We will try to take the flow diverter and place it across the neck of the aneurysm. So my flow diverter is already gone, and I've just started deploying it just from the supraclanoid segment of the ICA, and as we see here, we can see the distal marker of the flow diverter, and as we keep pushing the flow diverter out of the microcatheter, that's a way to deploy. You just have to push the microcatheter, you just have to push the stent or the flow diverter out of the microcatheter, and it'll just get deployed across the vessel that you want. So we can see now the flow diverter is deploying into the cavernous segment. This is after the full deployment of the flow diverter from here to here, and we take the microcatheter inside and try to go so that if there is some segment of the flow diverter which is not open, we can always do that. So that's a simple maneuver, and that will help us to open the flow diverter further, and just it looks beautiful now. Once we have the flow diverter across, you can see some amount of stagnancy in the aneurysm, and the flow diverter is very well covering the neck of the aneurysm. We have a coiling catheter tip over here, which we have put the coiling catheter here, and so we will just put some coils, loosely coil this aneurysm and come out. So we have just put enough coils to make it look little comfortable. You need not really pack it because you have a flow diverter across the neck of the aneurysm. No need to pack. You just have to rotate and see that the neck is well covered with the flow diverter. Everything looks good, and this aneurysm has enough coil for the rapid thrombosis. And now we can see the angiogram, which is looking beautiful. So you have the internal carotid artery going, and this is the part of the aneurysm which is very stagnant. This is the main part of the aneurysm. It's very stagnant now, and you can see the internal carotid artery which is taking a beautiful shape up, and the intracranial circulation looks perfectly all right. So this is the final run of the internal carotid artery, which is showing that there is a very good treatment of this large left ICA cavernous aneurysm, and this is the final picture where you can see that the aneurysm is almost gone, the flow diverter in place, and the blood flow into the ICA and the MC and the AC are perfectly fine, and this is a very good result as far as treatment of this large cavernous ICA aneurysm is concerned with flow diverter assisted coiling. Thank you.